أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum. My name is Professor Bilquis Shabbir and I'm Chairperson, Department of Medicine and Professor of East Medical Ward at King Edward Medical University. I hope all of you are doing fine. I hope your families are fine. And in case if somebody is not well or their family or any dear one is not well, we offer a prayer for them at this moment and ask Allah Ta'ala to relieve them of any type of physical, psychological or financial stress during these hard times of COVID. With this prayer, we start off with today's session. Today, I'm going to tell you about the basics of ECG. ECG stands for electrocardiogram, and as the name tells you, it is the graphical representation of the electrical activity of the myocardium, right? So all of you know that the myocardium has the ability to generate impulses. In fact, I was only going through some literature the other day, and very interestingly, there was a phenomena which he called an individual's aura. Like I have a different aura around me and person so and so would have a different aura around them. And one of the reasons was that he said that certain electrical activity is liberated from the neurons in the CNS, and this was his hypothesis of a literary person. And some of the electrical activity and electromagnetic waves are being liberated from the myocardium. So everybody with an individual heart and an individual mind would have a different aura around them. So this is just a literary aspect of the fact that electrocardiogram depicts electrical activity of the heart. This is Mr. Gambar, and he is going to help us as I explain the various leads to you and the various sections as we go on with the placement of the leads. So basically the objective of this lecture is to tell you what is an ECG, how are the impulses conducted on the various leads, how are they generated and how are they conceived, and what is the normal waveform which we should have in our mind in the various leads which you see on the ECG strip before we make a diagnosis, right? So before I start on with the actual leads, there's a concept, a very basic concept of the action potential of the heart, right? And if you remember your physics, I'll just be very, very basic because let's stick on to things we remember and which are practical in medicine. If this is the myocardium, I hope you can see, I kept the room dark so that you can see better. If this is a piece of the myocardium, these are the negative, this is the negative pole and this is the positive pole. And the impulse is being conducted from the negative to the positive pole. It will appear as a positive deflection on an ECG. So this is something very basic, that any waveform from the negative to the positive pole would be depicted as a positive deflection on an ECG. Now let's reverse. This is the negative pole, this is the positive pole, and the impulses are being conducted from the positive to the negative pole. Such a deflection would be seen on an ECG as a negative wave, right? So there can be a positive wave, there can be a negative wave, and there can be an isoelectric or a flat wave. What would the flat wave be? The flat wave may be because of two reasons. One is that either from the negative or the positive to the negative, the impulses are going, but they are too slow. So a flat wave would tell you that one, too slow to be picked up, right? Or secondly, that the net vector, now this is a vector going from the positive to the negative. The previous one which I showed was a vector which was going from the negative to the positive, which was showing as a positive wave, and this showing as a negative wave. Then maybe both are equivocal, that means they are of the same strength, right? And the net vector is perpendicular, right? So it's neither this way nor that way, it's perpendicular, and hence is not perceived as either a negative or a positive deflection, right? So a deflection on an ECG can be positive. This is known as a positive upward deflection, a negative deflection which shows a downward, which indicates a downward, or a flat wave which indicates an isoelectric waveform, right? So this is one aspect of the basics of ECG. Now, what is the concept? This reminds me of my KG, when our teachers used to write on the board and we used to be given this duty. It was assigned to one child or the other for that particular day to rub the board. So I'm doing this after many years. Now, the next part of it. What does the ECG machine looks like? I hope if you have ever seen an ECG machine, and I'll try to bring this into one of the consequent sessions or during this session. It has 3 clip-like structures and 5 to 8 suction cup-like structures, right? So there are big clips. I'll shortly be showing you them to you, and there are those cups, suction cups. Now those clips, if this is the person, so this is a guy, let's make him smile. So this is his body, right? He has got an upper limb, right, a lower limb, left, and right, and so these are the 4 limbs, right? So this is the right arm, this is the left arm, this is the right leg, and this is the left leg. Now, where do you apply these clips? These clips are applied to the right, they are applied usually over here, right? So they are applied on the right arm, on the left arm, and on the left leg, right? Now, when we talk about the leads, basically, rather when we talk about the ECG strip, basically it's a 12 lead strip. Now, where do the 12 leads come from? 3 of them are the bipolar limb leads. Bipolar, you can see it? Bipolar limb leads, right? 3 of them are augmented unipolar limb leads, and 6 of them are precordial unipolar leads. This adds to a 12 lead ECG. Simple, right? Now, coming back to this, these are the places where we apply the limb leads, right? So let's first talk about the bipolar limb leads, right? When you talk about ECGs and when you talk about the views from where you can see the heart, it is beautiful. You can see the heart when you use these 12 leads from various angles. Let's take Gambar. When you are doing the limb leads, Gambar is holding his heart, right? He is holding his heart outside his body. So when you are doing the limb leads, you are cutting Gambar vertically in a frontal way or a coronal way, so that he has an anterior part and he is cut into a posterior part, right? So Gambar's heart is going to be cut into an anterior half and a posterior half, right? So this is the way the limb leads are going to see the heart. On the other hand, the precordial leads which would be applied at various sites, I will be shortly telling you, on the chest at various sites in the precordium. They would be applied over here. They would cut the body horizontally into an upper section and into a lower section, and from there you would be able to see the heart, right? So limb leads cut the heart in a frontal way or a coronal way, in a way that the body is split into an anterior portion and a posterior portion, right? So the heart is cut into an anterior portion and a posterior portion, while the horizontal leads would make it into an upper portion and a lower portion, right? Now, what is the difference between the bipolar and the unipolar leads? Bipolar, simple, they have two opposite poles, right? Now, what does that mean and how does it go? First, we'll talk about, so there are 3 leads. One is lead 1, rather I like right over here. One is lead 1, 2 is lead 2, and 3 is lead 3, right? And then another concept you have to remember is that, which you are always told to remember, is always look at life from the positive side, right? Similarly, look at the heart from the positive side. Shortly you will be knowing what I mean by that. When we talk about limb lead 1, this is the negative pole, this is the positive pole, right? And since you are looking at the heart, and this is the heart, if you are looking at lead 1, you are actually looking at the heart from the left side to the right side, keeping the principle of looking at the heart from the positive side, right? So lead 1 shows you a transverse view. So you are looking like this, right? Transverse view from the left arm to the right arm through the coronal section. Coming to the next lead. So this is lead 1. Negative pole at the right arm and positive pole at the left leg. This is this. The angle should be like this. So this is the axis of this lead, which is lead 2. And coming back to our concept of looking at heart and life from the positive pole. So from where are you seeing? It is almost like Gumbar is sitting over here and looking at the heart from this angle to this angle, right? So it's negative on the right arm, positive on the left leg, and we are looking at the heart from the left leg to the right arm from inferior side. This is lead 2. Coming to the next lead. The next lead is lead 3. Here we have positive charge on the left lower limb and negative charge on the left arm. So what would be the direction of the vector? From the negative to the positive, and from where are we going to see the heart? Very obvious, from the left leg through the left arm, right? So what we are seeing the heart would be like this, right? So from this side to this side, right? So lead 1 would help us see the heart from the left side to the right side. Lead 2 will help us see the heart from the inferior to the right side, right arm. And lead 3 would help us see the heart from the inferior to the left arm. Okay. So this was about the bipolar limb leads 1, 2 and 3. Next we come on to the unipolar limb leads. Let me get this off. So I need cleared this up a little so as to facilitate. So coming back to the summary of bipolar limb needs, one thing I'd like to tell you is a name you might come across is the Einthoven's triangle, right? Einthoven's triangle shows the net vector activity when you are performing an ECG. It's a very simple way of putting it. So if we put this as the heart, and this is lead 1, this is lead 2, and this is lead 3, This is what we are seeing. This is, as I've already described, this is negative, this is positive, and limb lead 1 is looking from the left side, left arm to the right arm. Lead 2, this is negative, this is positive, and lead 2 is seeing the heart from the left leg to the, this is the vector, and it is seeing the heart from the left leg to the right arm. Lead 2, this is negative, this is positive, the vector is like this, and lead 3 is seeing from the left leg to the left arm, right? This is the Anthonian's triangle. Coming on to the other type of limb leads which I've just mentioned, that is the augmented limb leads. Augmented limb leads, they are unipolar, right? And they have the capacity to generate a very, very small voltage impulse. If the tissue is viable, it would be able to conduct that impulse in a certain fashion, and that would again depend on the charge of that particular limb where the lead is being applied. Now there are 3 types of augmented unipolar leads which you'll hear of: AVR, AVL, and AVF. Now what does it mean? They are applied at the same points, right? They are the same leads actually, they are clip-like, but the charge would be different when we record different leads. So if we again come to the Anthonian's triangle, this is the right arm, this is the left arm, this is the left leg. If we talk about AVR, this is positive and these would be generating negative impulses, right? So again we are looking at life with a positive, from the positive angle. So if we are looking at the heart from this side, that is the right arm, from this side, right, the one of the vectors would be going in this direction, right? The other vector would be going in this direction. How is it perceived at the right arm? It would be a general net of these 2 vectors which would be perpendicular, and this is the heart, which would be perpendicular to these 2 vectors. Resulting vector, which is the net vector, is the mean of these 2 vectors, and it would be perpendicular. So somehow it would look like this, right? So when you are seeing the life and you're seeing the heart with a positive aspect, what you're doing is, in the lead AVR, which is augmented unipolar right arm lead, you are seeing the heart from the right arm through and through, from upwards to downwards. So if this is Gumbar, you are seeing the heart from the right arm through and through, perpendicularly in the frontal plane, right? Coming on to the next lead, let's talk about AVL. Again, the application of the leads is the same. This is the Anthoghen's triangle, right arm, left leg. Now here what we do is the augmentation of the impulse which the ECG machine is going to generate, the leads are going to generate, would be in a direction that it would be negative at the right arm, it would be negative at the left lower limb, but it would be positive at the left arm. Right? So, what would the vector be like? One vector would go from one arm to the other arm, the right arm to the left arm. One vector would be going from the right arm to the left limb, and the net of these two vectors again would be perpendicular and it would be somewhat like this. And since we are seeing life from the positive pole, it would be as if you are seeing the heart from the left arm through and through the coronal plane. So, coming back to Gambar, negative, negative, positive. So, you are looking at the heart from the left arm. So, this is known as augmented unipolar L from the left arm, right? AVL, right? So, this is AVL. So, we have done AVR, which is looking like this. We have done AVL. Now, another way to look at the heart by augmented leads. What is left? AVF. Here we come back to the Anthoghen's triangle. Right arm, left leg. Negative charge, positive charge. This is the heart, right? So, I hope you are able to see it clearly. Yeah. So, one vector going from this to this direction, the other vector going from this to this direction, the net vector is going from this to this direction, right? So, what we see is that we see the heart from the inferior angle. We are seeing it from the inferior aspect, right? So, the augmented limb leads are helping us in seeing the heart from either right side, AVR, right upper limb, or the left upper limb, that is AVL, or from the left lower limb, that is, or the left foot, that is AVF, right? So, this is about the augmented limb leads. Now, we talk about the precordial leads, right? So, let me clear this up a little so that it's easy to understand. So, I cleared cleared the screen up, and while I was clearing the board up, the electricity came back. So, alhamdulillah, I'm feeling cooler, and maybe there's more light which you can see. Okay. We were talking about the precordial limb आगे और podium is दिल. तो दिल के आगे जो मैदान है, that is the precordium, right? So how, this is your basic knowledge of anatomy and probably you learned in third year. This is the manubrium, this is the manubriosternal joint or the angle of Louis, and this is the the sternum, and this is the xephisternum, right? At the angle of the manubrio angle or the angle of Louis, we have the attachment of the second rib, right? So this is the third rib, this is the fourth rib, ठीक है ना? This is the fifth rib. So we'll stay up till here. I'm sorry, not very aesthetic, but could indicate you the basics. तो हम थोड़ा सा और आगे ले जाते हैं on this side because more leads are going to be applied on the left side. क्योंकि normally दिल थोड़ा सा left side पे ज़्यादा होता है. This is the manubrioclavicular joint. So this is the clavicle. Sorry, ये बड़ी गंदी सी बनी है. ये है आपकी clavicle, right? So what you do is you palpate the manubrium, manubriosternal joint, and right next to it is the second rib. So right below is the second intercostal space. Right below that is the third intercostal space, and right below that is the fourth intercostal space, right? So what we do is second, third, fourth. We start off with lead V1. Now these are actually, suction cups. I'll be showing you. These are actually, this is like a cup, you can see it, and it has a wire attached to it, right? And it is able to generate a positive impulse. And as I've told you, you should look at the heart from the positive aspect. So it is a way of looking the heart, cutting Gumbel's heart horizontally and looking it as if as if you're looking it as an upper portion and lower portion transversely. So this is lead 1. On the same side, on the opposite side, at the same level, that is the fourth intercostal space, you have lead V2, right? Forget about V3 for some time. This is the clavicle. You remember the mid-clavicular line, right? So in the mid-clavicular line, in the fifth intercostal space, so the next space, you go and you palpate the center of the clavicle and go vertically down, so you have the mid-clavicular line. So here you apply V4, right? V3 is somewhere between V3 and V4, V2 and V4. So this is V3, right? So after applying V4, in between V2 and V4, we're going to apply V3. Where to apply V5? This is the anterior axillary line. You remember your axilla, right? And now Gumber doesn't have an axilla, but axilla is like a pyramidal process and has anterior wall and posterior wall and lateral wall. Lateral wall is formed by the inner aspect of the left of the arm, right? So the axillary fold, the anterior axillary fold is the anterior axillary line. So it lies somewhere over here. So you feel the fold of the axilla, anterior axillary fold, and you draw a vertical line, and in the fifth intercostal space you apply V5. So V5 is in the fifth intercostal space, anterior axillary line. Go a little more ahead. Mid-axillary line. Mid-axilla is the vertical line dropping down from the apex of the axilla, right? So इससे और आगे जाओगे तो ये हमारी अगर axilla है तो इसके apex से जो line fall करती है, in the same fifth intercostal space we'll have V6, right? And sometimes if we want to have a view of the posterior side of the heart in certain circumstances, we might need to put additional leads. So V7, V8, V9 we put in the same intercostal space from the posterior aspect. So from, like right now we have placed it over here, so it would be around the body in the fifth intercostal space on the posterior side. Why would we need to do that? I'll tell you shortly. Alright, so drop the cap. Alright. Now, all of these precordial leads, they have a tendency to give a positive potential, right? So they would be looking at the heart transversely, ठीक है? So गंबर के दिल पे इधर लगी हुई है EM leads and they are going to look into the heart transversely. Now I'll just make it a little down ताकि आपको diagram. Gumbar has to sit on the side and let's draw a section of the heart. So let's try to make it three-dimensional. So this is somewhat like this. Sorry, like this, like this, and like this, right? So this is the apex of the heart and these are the bases of the ventricles, right? And this is how you are seeing the various leads. So what you have done is you have applied V1 here. So your heart is like this, lying somewhere over the precordium like this. Right? And this is your view of the heart. So you have applied V1 over here, V2 over here, V3 and V4 over here, and V5 and V6 over here, right? So what you are seeing is, so V1 and V2, so if you see the heart placed like this, they would tell you maximally about the anterior wall. V3 and V4 would tell you maximally about the septum, and V5 and V6 would tell you maximally about the left lateral wall, right? So again, to repeat, V1 and V2 would be telling you about the right wall or the anterior wall or the right ventricle. V3 and V4 would be telling you about the septum, and sometimes also because if they are placed like this, they would also be telling you about the posterior wall, so septum and the posterior wall, right? And V5 and V6 would be telling you about the left lateral wall, right? So this is how the story of the different precordial leads go. Now, if you are suspecting some change in the septal leads, what you can do is, what I told you before, you can use extended leads, additional leads, V7, V8, V9, aligned along the posterior aspect of the heart to tell you further about the posterior wall, right? So this tells you about the 6-lead ECG, in order to summarize, bipolar, limb leads, unipolar, augmented limb leads, and precordial leads. These are 1, 2, 3. These are AVR, AVL, AVF, and these are V1 to V6, right? You want to see the right part of the heart, the maximum. So this is the heart, very easy to make. You want to see the right heart part of the heart. What are the limbs you would look at? The 1 and AVR, right? You want to look at the inferior aspect of the heart. What are the best leads to look at? 2, 3 and AVF. You want to look at the lateral aspect of the heart, the left lateral aspect of the heart. What are the best leads? 1 and AVL. And you want to see the precordium in cross section, the anterior or the right side by V1 and V2, the septum and the posterior wall by V3 and V4, and the lateral wall by V5 and V6, right? So in summary, when we look at the ECG strip, we see the changes in combination or alone in the various leads in order to make a possible diagnosis, right? Basically, to make it very easy, a lot of information can be retrieved from an ECG, but where it is most commonly used and which you must be knowing is ischemic heart disease, which includes angina, that is non-NSTEMI, we call it non-ST elevation MI, or STEMI, that is ST elevation MI. We'll shortly be talking about that. Then certain arrhythmias, which can be Brady, that is slow arrhythmias, and they can be tachy, that means fast arrhythmias, and which can be supraventricular, that is arising from above the ventricle or from the ventricle. And then certain other factors, certain metabolic disorders, they may bring out changes on the ECG, the pattern of the ECG. So certain electrolyte disturbances, certain presence of certain rather variation in the voltage, the height of the complexes, because of presence of something in between the two layers of the precordium. So there are certain other features as well. As we go along with the diseases, I'll be telling you more and more what to specifically see in a particular ECG in a specific disease, right? So this was about the basic physics, and the next session would tell you on what changes are seen on the ECG lining normally, and how do you correlate it with the physiology of the conducting system of the heart. So we stop this session, and inshallah we'll starting off with the new session in the next lecture. Thank you and stay safe.